to go.
So, good afternoon. It's Jane Lelean here from the Institute of Dental Business with Sue Boyton, the two wise birds. So, Sue, I'd like to hand you over and you can introduce yourself and then I'll just ask you some questions.
Hi, thank you. So, I'm Sue Boyton. I'm a dentist and I'm an independent dental-legal consultant.
Fantastic. So, Sue, here we are. It's Friday, the 3rd of April. And it's probably the second weekend of shutdown. So what are your reflections on this week within dentistry, where we are and where we might be headed?
And I think that's a really good question. I think it's been another challenging week for dentists and dental teams. We're getting a little bit more clarity on finances and teams, and people are able to sort out what they're doing with their teams. That's really important.
Absolutely.
But we haven't got clarity on the urgent care centres, and we need that for our patients. We haven't got clarity on messages from some of the CDOs. I mean, here we are on Friday and we're waiting for a webinar from the CDO England that's coming on nearly at the close of business today. And we really don't know what information's coming out for that. So it's still been challenging for dentists. I'll tell you something though.
Go on.
Yeah?
Yeah, go on. You tell me. Tell me.
I'll tell you something. I'm seeing some positives as well. What's happening here is people are starting to recognise the transferable skills that dentists and teams have. We've already known about them all the time, but outside dentistry, maybe people haven't. I mean, we know we're fantastic at infection control.
Oh, goodness me. Yeah, absolutely.
Every day, we're really good at that. Probably one of the best professions at infection control. We're really good at managing patients and managing patients' expectations. We understand patients and we're good at communicating with them. So there's a lot of positives there. I'm seeing some dental team members actually being redeployed and doing different things. I've seen people doing virus testing. I've seen people working on medical wards. I think that's good. I tell you what, I'm seeing some flexible thinking from dental teams as well. Not just waiting for patients to contact them for triage, but actively contacting patients so patients know that the practice is there for them, reinforcing some messages, and you know what? Just reassuring their patients that they haven't been forgotten about. So I like those things that are going on there.
Absolutely. And I've seen some absolutely amazing stuff. I've been discussing with my clients that things that they can be doing in this period. So I'm choosing to call it tools down, skills up. And this isn't just about skilling ourselves and our dental team, and we can talk about that in a moment, but it's also about upskilling our patients. So yes, dentists and their team are fearful, they're worried, they're anxious. And I have got a friend of mine that I was talking to the other day because he had an implant placed a couple of weeks ago. Now, unfortunately, his practice hasn't been in contact with him. Yet I'm working with other of my clients and we're suggesting ways and discussing ways that in the interim, they can be in contact with their patients. That we know that when we're at home, the chances are people's standard of personal care might just go off the boil a little bit. They might not want to get up. Some people are out of the habit of getting up, getting dressed, getting showered. And so those toothbrushing, tooth care regimes may just begin to fall off. So I've got clients that are producing videos customized to their patients about reinforcing of toothbrushing, tooth care, and if their TP brushes have run out and they can't get hold of them, how they can maybe using gauze to clean in between their teeth. So making sure that their patients are well aware of that. And of course, Easter's coming up. Sainsbury's have got a restriction on how many Easter eggs you can buy in one go. So we know people are going to be buying Easter eggs. So dentists that are on it as far as those dental health messages regarding diet, prevention and maintaining and building relationships with patients, I think it's fantastic. It's an amazing opportunity.
I think That's absolutely right. And I think sometimes for patients, it's just that reassurance that there's still someone there to talk to. It's not an emergency, but I can still contact the practice and say, what do you think about this? I'm worried about this gum here, something like that. And they can have some general discussion so they don't feel abandoned. That's hugely important.
Absolutely. And the number of dentists that I have seen and been talking to that are so generous in offering care, attention, triage, advice to patients that are pitching up on the phone, that are not patients of their practice,
Yeah.
but they're offering them that really genuine, compassionate care, irrespective. And these things are patient builders, because I think I said maybe in our last conversation, patients don't remember what you say, they don't remember what you do, but they will always remember how you made them feel. So our goal at the moment is to help our dentists help their patients feel special at the moment. Yeah.
What a good way of describing it. I think that's absolutely fantastic. There's a good take home for everybody there, I think.
Yeah, absolutely. So this is where we are now. What about next week? We've got the weekend. I hope everybody really is going to turn their phones off, turn Facebook off, and enjoy the weekend. We're forecasting sun. But what do you think people should be thinking about as we go into our third week of lockdown?
Yeah, and that's a really good question. And what I'm seeing some practices look at now is what can they be doing? What are all those jobs that they've put off that they think, yes, I'm going to maybe review my procedures, my protocols, make sure everything's up to date. I'm going to make sure everyone's CPD is up to date, not just the dentist, everyone in the team there as well. Look at, is there any practice development need that needs going on? Because there's lots of opportunity now for dentists and their teams to do this.
Absolutely. And I am 100% behind you with that, because I know that for particularly those practices where they've got NHS patients, they are paying their team members, they haven't been furloughed, and they want them to be active. If they haven't been redeployed yet, this is the perfect time. And certainly I have been asked to be running some training webinars. So I'm running a communication and sales webinar workshop in a couple of weeks. Reception skills training, again, is something that I've been asked to do. And I'm either doing those as open workshops or bespoke in the practices, because this is just fantastic with the technology that we've got. Every member of the team can be in their own homes and yet together, and we can have little breakout rooms, and it's as if we are really there.
Yeah,
And being
it's really
safe.
personalised.
I
Yeah.
know, it's just great. Absolutely. So I 100% agree with you. This is a fantastic opportunity to be talking with your team about what's our examination protocol. Do we need to review our decontamination protocol? Whatever protocols that you've got, because I like to think that everything needs a system, and we need a system for everything,
Yep.
so that nothing is left to chance. And this is the perfect opportunity to get your heads together without any fear that the team meeting is going to come to an end because a patient's going to be knocking on the door. Discuss, decide, act.
I think that's a really good description. Everybody can be using this to develop together. There's lots of opportunities.
Absolutely, absolutely. Fantastic. So, what are you going to do this weekend then, Sue?
I'm going to plant a vegetable garden, which I've never ever done before, so I'm really looking forward to that. How about you?
Well, do you know what? Great minds and all that. I've got my allotment, which I plant religiously. My goal for this summer is my terrace of 6 cottages. My goal is to keep us all self-sufficient in vegetables. So yeah, I'm going to be planning, preparing and planting earnestly. And actually that's what I suppose the essence of this call, isn't it? Plan, plant, or whatever I said. Prepare, plant and plan.
Yes.
So there's those 3 P's somewhere you can take out. Yeah.
Well, that's right. And be sure to plant some peas as well.
Be sure to plant some peas. We got too many pigeons for me to do that, so I won't be doing that. Anyway, Sue, I wish you a great weekend. Anybody that's been watching this, have a great weekend. If you've got any questions, do email Sue or I, and we can maybe answer them on the platform. And stay safe, stay healthy, stay happy. Bye for now.
Have a lovely weekend.
Bye.